Hello, my name is Annalie Martin, and today I'm going to be talking about the alternate methods of pain control, which includes the breathing techniques, focal points, visualization, and effleurage. I'm also going to be talking about controlled medication classification. So with the alternate methods, of pain control. We do have breathing techniques. This is something that relaxes you. It can reduce tension, and it can also be used as distraction. I know with some of with the enemas, and when you are placing a Foley and you have the patient take deep breaths, just because it distracts them. Also very common with labor, or just anytime somebody is in pain. The deep breathing is definitely a great way that they can just relax. With the focal points, that just helps them like concentrate on a thought, or getting like through something that's painful. So that may also be something like I remember learning about that when I was getting ready to have a child, but I'm sure that this would be very helpful in many other painful circumstances also. Visualization is where you are going to use like imagery to help distract you. Maybe you'll think about the beach, or just something positive. Now effleurage, that is going to be like when the nurse is going to massage in a circular motion, promoting that which will promote circulation. That relaxes the patient. It also warms up the muscles. Now when it comes to controlled medications, we have Shuttle 1, which in that case there's no current legal or medical use. There is a high potential for physical and or physiological dependence. So that is going to include things like heroin, marijuana, MDMA, ecstasy. And one nursing consideration that we learned in class about that is like right now in the hospital, like if somebody says like, oh, I take CBD for, my pain, we as the nurse are not allowed to like give them their CBD, because that isn't something that's regulated in the hospital yet. So our teacher said that she has never gave anybody CBD or anything like that. Now Shuttle 2 is like restrictive legal medical use. There is high potential for physical or physiological dependence, and there is a risk for addiction. So that's going to include like Adderall, cocaine, codeine, crystal meth, PCP, Percocet. So so you're always gonna, as the nurse, you're always gonna, of course, want to look at your hospital policy, but you're gonna want to include like the name of the patient, the amount of narcotic, the hour given, the name of prescriber, and your name, or if you're the nurse that's giving. Sometimes you do need two nurses, and usually that's gonna be with heparin, insulin, and chemotherapy drugs, and also vasopressors. So with Shuttle 3, they are accepted legal medical use, and there is a moderate high potential for physiological dependence, and a moderate risk for addiction. And that's going to be things like steroids, it's like testosterone, Vicodin. Shuttle 4 is going to be a low risk for addiction and abuse, and that's going to be things like Ambien, Ativan, Xanax, and Valium. And then Shuttle